Hi, good evening, everyone. Thanks for tuning in to this Health Talk session on vitamin B12 deficiency. My name is Wei. I'm a pharmacist in Malaysia, and I specialize in chronic disease management and medication management. I also involved in teaching and research activities. Before I start off, I also would like to thank your Daily Value for inviting me as a guest speaker to bring on this topic. So I would like to start off by introducing to you to B-complex vitamins. These B-complex vitamins might not be foreign to you, as you might already take some multivitamin and also B-complex supplements. And today I'm going to focus on cyanocobalamin or B12. So what are the B12 functions? So the B12 is important for the red blood cell production in our body. It is important for the health of our nervous system, and it's also important for our cognitive health or brain health. There has been some studies that show that a low level of B12 is actually linked to cognitive decline and also dementia. So where can you get your B12 from food? Some examples are like fish. 100 gram contains 2.2 microgram. Canned tuna, 85 milligram of tuna contains 2.5 microgram of B12. Liver, it contains a higher amount of B12, where 85 milligram contains 71 microgram of B12. Hard-boiled eggs contain 3.7 microgram of B12, and beef contains 5 microgram of B12. So as you can see, most of these products are of animal origin. And this is just a general idea to let you know the type of food that you can obtain B12 and also the amount. So are there any differences for the B12 that we obtain from our food as well as supplements? There is a key difference. So the vitamin B12 that we obtain from the meat, they are bound to the protein. And when we ingest them in our stomach, they have to undergo a separation reaction. And this will be done by our stomach acid. The stomach acid will separate the B12 from the protein in our food. And after that, this vitamin B12, which is already free, they have to bind to another protein that is produced in our stomach, which we know as intrinsic factor. So it has to undergo two processes before it is finally absorbed by the small intestine. On the other hand, the B12 that is found in fortified food or supplement, they do not undergo this separation reaction because they are already in a free form. So what are the common symptoms of B12 deficiency? Some people might feel more tired than usual. This is due to the reduced red blood cell production. Some might feel tingling or numbness because B12 is also linked to the nervous health. And some people might experience poor memory, become easily irritated or feeling low mood because this B12 deficiency is also linked to the low cognitive health or the brain health. So which population is at risk of this B12 deficiency? As the vegetarians and vegans do not obtain their food source from meat, so therefore they are at a greater risk for this B12 deficiency, and it is very important for them to actually consider supplementation of B12. And the vegans who breastfeed their baby, the baby might also be deficient of B12. The next population is the elderly population. And studies have shown that the elderly that's older than 60 years old, they're at higher risk of getting this B12 deficiency. This could be due to the decrease in the stomach acid production in this elderly. And we know that the stomach acid is very important to absorb the B12 from food. The third group of population will be those with malabsorption syndrome or experiencing the absorption issues in the digestion system. This could be people with Crohn's disease, celiac disease, or people who have undergone surgery to remove part of their stomach or intestine. And lastly is the patients that is taking long-term medications. One of it is proton pump inhibitor. So proton pump inhibitor is a group of medications that will reduce the stomach acid production. And we know that when our stomach acid production is reduced, the absorption of vitamin B12 from food will also be reduced. The next very common medications will be metformin, which is a diabetic medications. And there's been studies that show that for people with type 2 diabetes, when they're taking metformin, they actually also experience this vitamin B12 deficiency. And this is a recent studies carried out in Malaysia last year. And it shows that 28.3% of metformin-treated patients has vitamin B12 deficiency. And metformin use of 5 years and above is also linked with increased risk. And you can also find very similar studies in other countries and worldwide. And studies has proven that a link of vitamin B12 deficiency with the use of metformin. So in summary, B12 absorption is complex and it requires us to have an optimum gastric function. And there are certain populations, for example, like those elderly population or those who have some absorption issues in the digestion system, they are unable to easily absorb this B12 from food source. So I will now introduce you on some of the common ways of B12 supplementation. For intramuscular injection of B12, it is common in the clinical practice in hospital. It is a preferred method as it can deliver a higher absorption. So 10% of the absorbed dose can be actually absorbed by our body. And the downside will be inconvenience because you need a trained healthcare professional to deliver this intramuscular injection. And the idea of intramuscular injection might not be appealing for some people. And also for intramuscular injection, usually the doctors will recommend for those with severe B12 deficiency. So the next very common supplements of B12 will be oral supplements or oral administration. So a 500 microgram supplement of B12, which is commonly available in the market, our body will absorb about 2% or 10 microgram of it. And you rarely will see a dose larger than 500 microgram pill because studies have proven that the absorption rate will decrease with larger dose. So oral supplements are easy, they are very effective, and also they are less costly. So the next form of administration will be sublingual routes, which has more research these days. So this sublingual route, through this sublingual route, our body is able to directly absorb the medication or supplements through the sublingual capillaries under the tongue. So this is very good for those with swallowing difficulties or those with severe intestinal malabsorption or other digestive absorption issues because it will bypass the digestive system. And the B12 can be also directly absorbed from the sublingual capillaries under our tongue into the body. So there's been some research that shows to prove the efficacy of sublingual B12. And last year, a clinical trial has shown the efficacy of this sublingual B12 is comparable to the intramuscular injection. And for this sublingual route to be recommended in a routine clinical practice, we will also need to read more clinical trials and also more evidence-based to come in the future. So my recommendations will be, if you are vegans or strict vegetarians, you should consume B12 supplements to prevent deficiency. And for elderly and those taking medications that reduce stomach acid and also those taking long-term metformin, okay, they should also consume B12 supplements. If you have the symptoms of B12 deficiency, or if you know that you are the high-risk population for B12 deficiency, please seek advice from health professionals. And the sublingual form of B12 may be advantageous if the absorption via digestion is being impaired. Okay, so my sharing just now is based on some of the scientific evidences from journal or websites. Okay, so that's all for my sharing on this B12 deficiency. I hope that you have gained some useful knowledge from this talk. So be healthy and stay safe. Thank you.